Good evening, everyone, and welcome to our annual benefit, Heroes in Health Care. In support of VNA Care, I am Dr. Malika Marshall, and I'm honored to be back as your host. Heroes in Health Care is one of the events I look forward to the most each year, and while COVID-19 has prevented us from gathering together in person, the pandemic has not dampened the support of our loyal friends. Thank you to our many sponsors who once again have made this annual event a major success. I welcome you to a heartfelt program celebrating the remarkable work of VNA Care's nurses and clinicians and honoring the achievements of our 2021 Heroes in Healthcare, Moderna and Pat Kelleher. I will now introduce Todd Rose, President and CEO of VNA Care. Todd leads the organization with an invaluable mix of expertise, optimism, and most of all, an enormous commitment to the most important stakeholders, VNA Care's staff and patients. Welcome, Todd.
Hello, and welcome to our virtual Heroes in Healthcare Gala. It is great to be here with you in celebration and support of this outstanding organization. VNA Care was born out of a crisis to improve the health of our communities, and this year's Heroes in Healthcare, Pat Kelleher and Moderna, share our mission to advance the quality of life and independence of so many. I want to personally congratulate the both of you. I also want to acknowledge our presenting and trustee sponsors, Corridor, Mutual of America, Joshua and Amy Boger, and Home Care Home Base. And thank you to the rest of our generous sponsors. It is support of this magnitude that helps us advance our services and our reach. It is because of you that we've been able to provide comprehensive home health and hospice care in the community for over a century. I offer my utmost appreciation to you and our clinicians for persevering, putting your heart into this important work, something that has been, if possible, even more profound during these complicated days of COVID. Please join me in recognizing our clinicians for the incredible bravery, resiliency, and skills shown throughout this pandemic. Thank you for joining us and understanding how important home health and hospice care is for all of our loved ones.
It's my pleasure to introduce this year's honorary chair of the Heroes in Healthcare Gala, the Governor of the Commonwealth of Massachusetts, Charlie Baker. Welcome, Governor Baker.
Good evening. This is Massachusetts Governor Charlie Baker, and I'm delighted to be with you this evening virtually and serve as the honorary chair of this year's Heroes in Healthcare and have an opportunity to offer my wholehearted thanks and gratitude to the frontline heroes at VNA Care who have worked tirelessly to serve families and protect our communities throughout the COVID-19 pandemic. Through the depths of this public health crisis, VNA Care's clinicians went into patients' homes to provide quality, hands-on healthcare services and offer families guidance and knowledge on how to mitigate the spread of COVID-19. And they did so under enormous stress and with risk to their own health and safety, with unwavering courage and commitment. Even during ordinary pre-COVID times, VNA Care is steadfast on the front lines of healthcare services, protecting and caring for families statewide. You serve as a lifeline for residents of all ages and show up day in and day out, no matter the circumstances or the emergency. Too frequently, access to critical medical care and healthcare services is complicated. We all know that, and can be very difficult to navigate. However, thanks to VNA Care and its team, our most beloved generation can receive the services and the care that they need to age gracefully where they would like to, at home. The burden of chronic illness is lessened, and our elderly loved ones facing the end of life have the dignity and compassion that they so deserve. On behalf of the entire Baker-Polito administration, we're so grateful for your commitment to quality service and compassionate care. I want to thank you for all that you do on behalf of our elderly community here in Massachusetts. It's very special, and as a son of a 93-year-old dad, I more than get it. I hope you have a wonderful evening, and thank you.
Thank you, Governor Baker. We appreciate your being here with us.
Before modern medicine existed, VNA Care was created with the vision that everyone deserves access to health care. Everyone has the right to good health. Serving on the front lines after soldiers returned from war, badly scarred and injured, providing a viable alternative to institutional care for those with mental illnesses and disabilities. When other providers said no because of HIV, AIDS, VNA Care said yes. When neighborhoods struggled with rising crime and others feared to go in, VNA Care didn't turn away. When people began being discharged from hospitals earlier and sicker, VNA Care stepped in with wound care and therapy. During COVID, we were once again on the familiar front line.
Today, more and more care is brought closer to the patient. That's important because while we have the best hospitals in the nation right here in Massachusetts, we know that care should be provided in the most appropriate setting. Also, right here, we have world-renowned biotech companies discovering therapeutics that extend life, cure diseases, and treat illnesses. People fly into Boston from every nation to see our acclaimed specialists and surgeons and access the most advanced medical equipment and technology. But without visiting nurses and home-based rehabilitation therapy and social worker support, people would remain in the hospital and other inpatient facilities for extended periods of time, raising the risks of acquiring an infection or developing complications. Never mind the loneliness and confusion that can set in for some when they're in an unknown environment. Without visiting nurses, extraordinary medicines could not be provided at home. It's the visiting nurses that make the delivery of intravenous therapy, infusions for cancer treatment, and complicated wound care management at home possible. They are the very heart of our complex healthcare system, and yet often behind the scenes. The kinds of cases they handle every day, cardiac issues, cancer support, people being discharged from the hospital after a broken hip and post-surgical care, care for the seriously ill and dying, these are essential healthcare services that VNA Care provides for people of all ages, in every neighborhood, every single day. These nurses help get people back to work, back to their lives, back in the community, and they help people live with independence and restore dignity to our family members facing the end of life. Through the depths of the COVID-19 crisis, VNA Care's clinicians continued to go into patients' homes to provide vital healthcare services. And when the world shut down, for many vulnerable patients, this was the only face-to-face visitor they would see all week. Their skilled care is uniquely personal and rigorous. As you may have heard me mention in the past, VNA Care was invaluable in helping me and my family care for my father as he coped with a terminal illness. And I know firsthand that VNA Care has stepped up big time to help those in need during COVID under extenuating and often unpredictable circumstances.
Today, never have so many people lived so long. As the culture of aging continues to evolve and more families are more dispersed, more care is moving toward the home. And as baby boomers face questions about the care they will need and how and when they want it provided, the demand for aging-in-place home care will skyrocket. VNA Care services will need to rise. Acute care at home will become commonplace. More specialized services will be designed and personalized for the frail and those in cognitive decline. We will continue to address social problems so intimately identified in this service.
Tonight, we also join together in pledging our support to VNA Care's Emergency Response Fund, which ensures this organization can continue to strengthen its impact. Thank you for your generosity. VNA Care cannot accomplish its mission without your help. We now have a very special performance from the remarkably talented Junior Cias.
Run away, I know tomorrow's better than your yesterday. See my face and know I'm sure. Leave me here, 'cause I'm still picking up the pieces of my life. And though I'm down, I'm still aware. And when my sun is rising, the moon is high on your side of the world. And even though you're far, your heart is closer than it's ever been before. We don't need to be close to love. Being in love is close enough. There's more time and more space. You're gone and I change. We don't need to be close to love, 'cause we're close. We don't need to be close to love. Being in love is close enough. There's more time and more space. You're gone and I change. We don't need to be close to love, 'cause we're close. Run away. I know tomorrow's better than your yesterday. See my face and know I'm sure.
Junior, you're incredible. Thank you for being here with us and helping to make this event so memorable. I am now pleased to introduce Patricia Kelleher. Pat has used her passion and platform as a nationally admired leader to ensure that home-based care is valued so we can live with independence and remain at home within our communities. She has made an extraordinary impact in her long tenure as CEO of the Home Care Alliance of Massachusetts. She's been the face of home health care in Washington, D.C. and on Beacon Hill for over 2 decades. Whether it's advocating locally or federally for home care to receive the investment it deserves, or identifying ways to solve the healthcare workforce crisis, she is a strong strategist, undaunted by challenge. Pat has designed programs to support emerging leaders at all levels and developed clinical certification programs to advance the skills of nurses practicing home health and hospice care. For individuals and family members seeking support, she created one of the first searchable online databases of home care services. Under Pat's direction, the Home Care Alliance of Massachusetts was the first state association to create guidelines for agencies admitting COVID-positive patients. When home healthcare nurses and clinicians were not included in the first round of healthcare worker vaccines, Pat reminded everyone, truly everyone, that this workforce is caring for many more COVID patients than those admitted to the hospital, and they are key to preventing community spread of infection and ensuring medically frail people are able to remain safely at home with continued care. As you can guess, people listened, and home care clinicians were moved up in priority for the vaccine. In countless ways, Pat has set the pillars for success within home care, and her legacy will continue to be influential years after she retires in just a few months. I welcome Pat Kelleher to accept the 2021 Hero in Healthcare Award. Please join in congratulating her on this well-deserved award.
Thank you, Dr. Malika, and good evening, everyone. First, let me say it's incredibly humbling to share a virtual stage with the miracle workers of Moderna. You gave life and hope to so many. Believe the science, everyone. And to Boston VNA and VNA Care, you are so special in my heart. Few people know or remember this, but I actually came to the Home Care Alliance because I volunteered a long time ago with this organization, including supporting their special events like this one. The then director of the VNA insisted I apply when the Home Care Alliance executive director position became open, and I did, and here I am 20-something years later. It's been a great privilege to support the work of home care, a sector whose impact is too often in inverse proportion to its recognition. It's been my great honor to help clinicians to provide more care and comfort, to support struggling families, and to alleviate suffering in our community. Truly an honor. As I thought about how home care has remained true to what it has been since agencies such as this one began a century ago as district nurses and how it has changed, I remembered a favorite photo that was hanging in our offices for many years at the Home Care Alliance. It was submitted by a Boston VNA nurse to a photo contest we held in the early 1990s. It was her completely filled, handwritten date book schedule, photographed next to a hardwired phone where she was confirming the next day's rounds. Today's nurses might not imagine a world with paper schedules and no cell phones, but I know they appreciate that while technology and the core service mix have changed over the decades, unchanged is the core mission of home-based care, as patient-centered, cost-effective, life-changing, and in many cases, life-saving. I often said over the years that I worked at the Home Care Alliance that we didn't need another TV show covering drama in the ER. We needed one covering the incredible gamut of care in the home. And then I discovered we had one in the BBC show called The Midwife. Let me then close with this most eloquent description of home care, which was read by the incomparable Vanessa Redgrave in the opening to Season 9, Episode 5. Just substitute VNA for Nonanta's house, and you'll get the picture. This is what she said. There are times when the world seems to pause in its perpetual spinning, as life begins or as life ends. The Nonanta's house nurses were guardians of these thresholds. They brought a wise word or a gentle glance at the very first breath, or comfort or blessing at the very last. They brought wisdom, they brought care, and they brought love. They were witnesses to all that mattered in struggle and loss or triumph. Other people's lives were their lives, and they gave all that they had. They did not stop to count the cost, as this was their calling and their joy. Working alongside all of you in home care has been my joy. Thank you, Boston VNA, VNA Care, for what you do for my hometown. Thank you to everyone who supports this incredible organization. And thank you to my mom for raising me to care and to act. I am so honored that you all thought of me tonight.
Thank you, Pat. We wish you much joy as you begin your next chapter. Now it's my pleasure to introduce VNA Care's Hero in Healthcare Award to the biotechnology juggernaut that developed and deployed an innovative mRNA COVID-19 vaccine in record time to protect against the coronavirus, right here in Massachusetts. Moderna's breakthrough mRNA vaccine and the global pioneering efforts involved in its rollout is credited with saving countless lives. Moderna's life-changing achievement is healing a wounded world and profoundly returning hope for those who witnessed and cared for the sick. It's my pleasure to introduce Andrea Blood, Moderna's Associate Director of Clinical Supply Operations, to accept the Heroes in Healthcare Award on Moderna's behalf. She and her team have played a pivotal frontline role in the deployment of the vaccine, which we as frontline clinicians know is often the most challenging place to be.
I am extremely honored to accept this prestigious award on behalf of Moderna. Being part of the clinical development organization of the COVID-19 vaccine has been an extraordinary and humbling journey. When I took this job at Moderna, I knew I wanted to make a difference and do something impactful. Little did I know the difference would be this big. When the virus exploded across the world in early 2020, we were able to go from sequence to release of a vaccine into a phase 1 clinical trial in 42 days, then proceeding with subsequent trials of which data showed immune response, safety, and efficacy, enabling Moderna to deploy to millions of people in less than a year. It is remarkable to be a part of this achievement and to know the tireless efforts resulted in an immediate life-changing intervention for billions of people for humanity. That this recognition comes from the nurses and clinicians at VNA Care makes this award especially meaningful. These frontline clinicians work often behind the scenes to take care of the majority of us who are most vulnerable to COVID-19. They keep on going from home to home to ensure their patients got the skilled care they need to remain independent outside the hospital. They did this before there were vaccines and therapeutics, as they had centuries ago during the 1918 pandemic. Thank you from all of us at Moderna.
Thank you, Andrea, for sharing your story, and congratulations on all you've achieved. I am delighted to welcome Catherine D'Amato, President and CEO of the Greater Boston Food Bank and a member of the Heroes in Healthcare Honorary Committee.
Thank you for inviting me to be a part of this event. Both GBFB and VNA Care serve as vital organizations that have a long legacy in serving the community and empowering people to achieve their best health through a shared mission to help people who experience health or socioeconomic challenges to live independently with dignity. By virtue of being in someone's home, a visiting nurse knows what the nutritional needs are. They know if the cupboards are bare or if food isn't meeting the nutritional need of the individual, or if there are mobility issues and you can't get to the store to get your own groceries. VNA Care social workers have worked with GBFB and our partners for decades. They've connected patients to local food pantries that we serve. They've made sure that deliveries get to the home or provided educational materials as needed. If it weren't for VNA Care, I don't want to speculate what would have actually happened to some of our most vulnerable citizens. Congratulations on your 135th anniversary, and thank you for your extraordinary care and support. You make resiliency and compassion wonderful.
Thank you, Catherine, and thank you to everyone at the Greater Boston Food Bank for bringing resources to relieve hunger across eastern Massachusetts.
Greetings, everyone. My name is Steve Molinari, and I'm the Chief Revenue Officer at Corridor. And Corridor is proud to be a presenting sponsor of the 2021 Heroes in Healthcare Gala and to celebrate VNA Care's extraordinary 135th anniversary of mission and legacy serving the community. At Corridor, we're committed to supporting great organizations that share our commitment to improving lives through home-based healthcare. We couldn't be more pleased to help recognize VNA Care's home health and hospice nurses and clinicians, these women and men that are a lifeline for all of us who wish to remain at home. Thank you from all of us at Corridor.
That closes out the 2021 Heroes Gala. Thank you for being with us tonight, and congratulations to our 2021 Heroes in Healthcare. Good night, and see you next year.